Hi, my name is Grace Macaluso. I am going to be performing my skills checkoff video for colostomy care. I am wearing school appropriate scrubs and my school appropriate name badge. I have all the supplies for my patient here, and I have my stoma guide and clean gloves and my hand sanitizer for performing hand hygiene. So I'm going to stand up and have my camera pointed down so you can see me performing this skill. Okay. I'll start by introducing myself to my patient. I'm going to knock on the door and enter and then close the door behind me to provide patient privacy. I'm going to wash my hands and introduce myself. Hi, my name is Grace. I'm going to be your nurse today. Can you verify your name and date of birth, and I'll check your wristband. Okay, I have the right patient verified name and date of birth. I am going to explain the procedure to my patient. Mr. Smith, I just need to do some colostomy care. I need to remove the old colostomy and inspect, make sure I assess and see if there's any abnormalities that I need to report to the doctor, and then I'll put on a new colostomy device. Is that okay with you? Okay, I've explained the procedure to my patient, and I have obtained informed consent. So I will start by putting on my gloves. Then I am going to remove the old colostomy device, disconnect it appropriately, and then I would discard the contents in the toilet and throw the bag into the garbage. And the colostomy appliance device, I'm just going to peel all the edges up towards the center of the stoma to prevent any skin breakdown. I would also throw this in the garbage, and then I'm going to clean around the stoma and throw in the garbage. I'm going to inspect and assess the stoma. I want to make sure it's not an abnormal color. There's no abnormal drainage or discharge or any abnormal smell. I want to make sure it doesn't look purple. It looks clean, it looks healthy. There is no signs of infection or anything abnormal that I need to report to the provider. And then I will, after I've cleaned around the stoma, I'm going to dry around, throw that in the garbage. I'll use the skin prep. Actually, first of all, I will use the stoma guide to measure around the stoma, because I want to make sure that when I put on the new stoma, I've cut it to the right size. So I have my stoma guide, a couple circles cut out. The 1 3/4 inch is too big, so I'll try 1 1/4 inch. Okay, that one is the correct size. That's what size I want to cut. I'll throw this away in the garbage. I want to cut the new appliance device to fit 1 1/4, which I have done, and that would fit correctly. So I'm going to I'm going to use skin prep. This will act as my skin prep for this video, and I would go all the way around the stoma with the skin prep, and then I want to make sure that it dries completely. Throw this in the garbage. Make sure that it dries completely before I put on the new appliance device. So I will peel off this and carefully place it, and I'll pat down around the stoma to make sure that the adhesive sticks the way that it should. Make sure that there's no areas that are going to bubble or bunch up. Okay. And then I'll secure my new pouch. And then make sure that's on securely. And I can even have my patient press his hand down on top to help the adhesive adhere to his skin. Make sure that it's on there correctly. And then I will make sure that I fold the clip appropriately. Also, when I'm throwing away the old colostomy bag, if I needed to save the clip from the previous bag, I would make sure that I do that and not throw that away. But I've attached the clip correctly, securely, and now make sure that that is good. Okay, everything is good here. I'm going to remove my gloves and dispose of those, the garbage. And I want to wash my hands. And then I'm going to check with my patient. I just want to make sure that he's comfortable. I want to give him his call light. Here, Mr. Smith, here's your call light. Do you have any questions for me? Is there anything that you need from me? Okay, I've done everything, taking care of my patient. Everything is good here. I'm going to leave the patient's room now and close the door behind me to provide privacy, and then I will document the procedure and communicate any concerns to the provider. This completes my skill.